For the first time as a nation, we're recognizing that people have a right to not be destroyed by sickness. And under the Senate bill passed by the House and signed into law yesterday by the President, folks are no longer going to have to choose between their health and their pocketbooks. Parents will no longer have to worry about whether they can afford to get their kids to the doctor. And seniors won't have to wonder if Medicare will still be there for them several years down the road. Healthcare reform doesn't mean people won't have to continue taking responsibility for themselves. And the bill we passed, and even the one that we're now debating, improves healthcare affordability and access for all, but it still requires folks to do their part. Families that can afford to will be asked to contribute to the cost of their coverage. And people are expected to get regular primary care so that they don't end up in the emergency room with something that could have been treated easily and cheaply if it had been addressed sooner. But very importantly, we're also going to hold the insurance companies accountable. We're finally telling them you can't drop someone just because they get sick. You can't cap someone's benefits just because you're tired of paying for their care, and you can't decide not to offer someone coverage because they have a pre-existing condition. We're telling them no more, no more, no more. We're also saying to our seniors, we as a nation remain unwavering in our commitment to protect and preserve Medicare for today, tomorrow, and the next millennium. There's been an awful lot of misinformation going around about Medicare and something called Medicare Advantage. Fact is, the original Senate bill proposed an unfair way to fix overpayments to these private Medicare HMO insurance plans. The fix would have come at the expense of seniors living in areas with high medical costs, such as my state of Florida. I was able to pass an amendment in committee that fixed that problem fairly. Under this bill, this reconciliation bill, the President has proposed another way to rein in those Medicare Advantage insurance companies, one that upon close inspection also treats seniors fairly. It puts companies on the hook for their performance. If they don't provide quality service, their reimbursements are cut. And their enrollees, the seniors, are going to demand that they provide quality service. I appreciate the President's leadership on this issue and the fact that he heard the concerns expressed by a number of us, including Senator Schumer and Senator Wyden. But having said all this, I want to say that we've left something undone in this Senate bill that is now law and even in this reconciliation package. I'm not happy that this legislation lets the drug companies pretty much off the hook. You all know that over the past few years, I've been voicing the concerns and the fears of residents in my state about what's happening to their drug prices. I also hear from the folks who can't afford their medications when they hit the prescription drug coverage gap known as the donut hole. They skimp on food or split their pills or stop taking them altogether. And while this bill offers a discount to seniors in the donut hole, there's nothing to keep drug companies from continuing to jack up the prices until that discount is meaningless. I also hear from folks who are frustrated that in other countries, folks are getting the very same drugs for much less than we pay here. And I had an amendment that would have required the drug industry to pay its fair share of the tab for health care reform. It required the drug manufacturers to give the government price breaks on drugs for a lot of our low-income seniors. And that would have saved us $106 billion of taxpayer money, which was more than enough to fill the donut hole altogether and then make a dent in offsetting the federal deficit. So I intend to come back and to revisit this. And in the meantime, I want to say that this reconciliation bill deepens and extends the promise of health care reform and the health care reform bill that was signed into law just yesterday. I stood with the president when he put pen to paper yesterday. I think it's great we've begun the process of health reform. It's been said by many folks in many different ways that we are not put on earth for ourselves, but we are placed here for each other. Well, here we are, and here we are debating legislation that stands to improve the lives of tens of millions of Americans. And so, despite its flaws, I will vote to pass this legislation.